Morning, Craig.
Morning.
We got everything set up on this end, so everything's live and all that good stuff. So you guys are good to go.
So we're already live.
Yep.
Yay.
We don't need to record, right?
No, we don't need to record.
Okay. Yep. Then you guys are good to go.
All right, cool. Morning.
I cannot hear. No, we cannot hear you.
Can you hear me?
I thought I did for a second there, but
Testing.
Yay. Lisa, I edited the proposed board meeting schedule to add another column. Oh, and I lost you again. Sound. I basically added a virtual in-person column, letting everybody know which way the meetings were going. I still can't hear you. For some reason, you just cut out again.
Good morning.
Good morning.
Hi.
Hello.
Morning.
Morning.
Hey, Craig.
Hey, how are you?
Good. How are you?
Happy it's Friday.
Yeah.
You know, that's great. I'm so excited it's Friday. I'm so happy it's Friday.
You made it.
Yes. Hey, Craig.
Yes.
I have Lisa on the phone here. She's having some technical difficulties. I'm gonna go troubleshoot with the IT real quick
Okay.
and then get back to you.
All right. Cool.
Okay, that person would.
Greg, what's going on, buddy?
Same old, same old. Happy it's Friday.
Yeah, we got one more week till spring break. It's like I saw a shout out from one of my friends. Did you guys have a bunch of interns down at the city building for a little bit? Craig, talking to
Yeah.
you, right? I realized that wasn't descriptive enough.
No, but happy to get shout outs.
Yeah. It was like, it was Mariah Carr. She threw something out on Facebook thanking you for I don't recall what her daughter was doing. I was like, I'll holler at Craig when I see him.
Glad we could help.
Yeah. Come on, Barry. Be good, man. Anyone's bracket in shambles yet? Everybody still doing good?
I gave up on it.
Oh yeah.
Too heartbreaking. I was doing pretty good last year with some rounds advanced, but then fell apart. I just didn't get around to doing it this year.
Hmm. It was like we do one at the NCAD, and I think we got like 60 brackets in there. I was like, I think I've got like four down from yesterday. I thought Louisville was going to be a little more motivated after getting underseeded, and you're like, oh, that's what I
Yeah,
get for believing in you.
not a Louisville fan.
Nor am I, but was trying to give little brother a little, little hope because I was like,
Yeah, I get
that
mixed.
that was
Stepson went there, and a niece went there, and I mean things have settled down now, but used to get pretty heated back in the Rick Pitino years when they had a little bit of something going on.
is so my wife, my brother-in-law, and I all went to UK. Her two cousins both went to Louisville.
Yeah,
And I was like, yeah. And then her aunt and uncle became big Louisville fans, even though their oldest son, he's a huge UK fan. And then his wife went to UK. And then my wife's whole family is UK, and then her parents are big UK fans. So yeah, like you get here that we won our national title, then they win theirs, and it gets revoked. And I mean, yeah, it just spirals down from there.
yeah. I'm not a. I've lived here for close to 40 years and not a native, but my son's a UK grad and daughter went there for a year and then came back home and finished up at NKU. So big cat fans.
Nice. It's like I've had
Awesome.
season tickets the last couple of years with one of my wife's sorority sisters. I was like, we went to a bunch of games early that season.
So I got to ask you what I found myself rooting for Arkansas because I wanted to see the SEC do well. But then round two, I'm looking forward to Rick Pitino
Exactly the same.
schooling Cal.
Exactly the same. My wife and my brother-in-law were like, the hell with that used car salesman. I was like, you guys can hit him all you want. I want to see him and Rick Pitino play. I was like, I got to see it. I was like, because if Cal's going to overperform, this is where he does it. Oh, you haven't won a road game in the SEC all year? You're going to take Josh Harrelson and, Brandon Knight to the Final Four. Dude, their roster is loaded if they were healthy. They could do it. In Kansas, I go, what a great matchup. Kansas sucks. They're not good on paper. They're not good in the eye test. Hunter Dickerson has made all his money and he's done playing college and he's not going to the NBA.
Maybe I was asking my son this last night. We were texting. Maybe it's just my biases, but does did Cal always sound this bad? I mean, he sounds so bad in these interviews. I don't know if it's just I'm paying more attention to him now and looking for negatives, but just comes off almost very inarticulate, makes excuses, and he's hard to listen to.
Well, no one thinks fondly of
Okay.
an ex-girlfriend, right? It is
Yeah,
what it is.
yeah,
Well,
yeah.
once the veil's off, the veil's off. Yeah.
There are so many teams in the brackets. We can talk about this all day.
Yep.
However, we have another meeting to attend to.
Are we ready? Yeah, it's
Almost.
9:03. I'm sorry. I was just filling time.
Yeah.
Yeah, no, that's good.
I was waiting for Chris to get back and lead us.
Yeah, we needed it because we're having some technical difficulties with one of our participants.
All good.
But I think we found a workaround. So,
Correct.
so we'll go ahead and
Is Lisa on?
She's
Her phone's muted right now, but yes. Unmute
yes.
your phone.
Yeah,
I think you should be good.
Yeah, there was some feedback. Somehow another mic's picking up, but not just doing something. So we'll
Well,
work on that.
If
We'll
we
let you know.
if we need to share a screen, I can share my screen for the meeting materials. So
Cool. So we'll go ahead and get started and call this meeting to order. Mr. Secretary, do we have quorum?
yes, we do.
Yeah. Okay, I agree. All right, so next item on the agenda is the approval of the agenda. But first, I do want to remind the voting members, we do need to see you per state statute. So please turn on your videos. Just a reminder. So next item on the agenda is approval of the agenda.
Motion to approve the agenda.
Right, motion made. Is there a second?
Second.
All right. Motion made and seconded. All in favor, please say aye. Aye.
Aye.
Any opposed? Okay. Moving along, next is the approval of the minutes of our last meeting. Are there any corrections or changes?
I didn't see any.
I'll make a
Craig,
motion
make a
to
motion
approve.
to approve the minutes.
All right, motion made by Harry, seconded by Chris. All in favor, please say aye.
Aye.
Any opposed? All right. Motion passes. Next item on the agenda is the financial report.
Okay, can everybody hear me now?
Yes, ma'am.
Yes.
Yay. Whew, that was close one. Okay, I'll go ahead and try to share my screen. If not, I think Chris is going to share his screen. It says host disabled participant screen sharing.
Hmm.
Clay, can we?
I'm looking at that right now.
Thank you.
I thought I had that up. Can you it's not giving me an option to do that. I don't know why. Can you request to have that shared on your thing? Oh, hold on. Multiple participants. You should be able to do it now.
Okay, yeah, I think it's letting me now.
Thank you, Avery.
Okay, can everybody see the spreadsheet there?
Yes.
Okay, perfect. All right, this is the financial report through February. And what you'll see is the attachment point in the column B there. And that is your maximum claims amount per your stop-loss contract for this year. And through the first 8 months of the plan year, the attachment point was about 4.1 million. You had in-network claims of about 1.9 million, out-of-network claims of about 849,000, pharmacy claims of about 601,000. Your total fixed costs were about 742,000. So the total plan costs were about 4.1 million. And so far, we've had about $70,000 back from the stop-loss carrier. So after you net that out, it results in total plan costs of about just a little bit under 4 million. And we have collected about $4,062,000 in premiums. So you are in a surplus situation to the tune of about $63,000. And then if you add in pharmacy rebates through February, that's another $94,000 in revenue. And we now have interest coming in, and that has been about $23,000. Decory fees were paid this year, about $1,700 for that. And your specialty drug HRA claims have been about $85,000. So when you combine that with the prior year reserve amount of 1.85 million, it results in a current reserve of about 1.9 million. And through 8 months, you're running at about 77% of your aggregate, which is great. We'd like to see between 75 and 80%. That is the financial report. Any questions?
Now, what a turnaround. Because back in December, it looked rather bleak.
Yes, well, you know, as the year progresses, people start hitting specific deductibles. There's more money on the stop-loss carrier. And it's actually turned out to be a pretty good year.
Nice. I guess we still have a couple months left, right? Like, it can always get better.
Yeah, yes, and we expect, and as you'll see when we get into the budget projection, that you'll probably end the year with a bigger surplus than this if everything goes along as it has for the first 8 months.
Nice.
Okay. All right, so moving along to our agenda items. I'm not sure how, but I think we missed the MedBin report. So
yeah, I think that's the plan cost update.
plan cost update. Okay, cool. Awesome.
Yeah, and before Brooke gets into her report, I just want to kind of give you the overview. As we just discussed, it's turning out to be a pretty good year. And as you'll see on this page, your per employee costs are projected to be down about 9% from last year. And the primary reason for that is there is less high claimant activity in your plan this year. In fact, about $300,000 less in high claimant activity. So that's kind of the big picture, and I'll let Brooke get into the details.
Okay, can everybody see my screen?
Yes.
Okay. So this looks back to your plan year in 2020, 2021, and then over to the right-hand side, we have an 8-month update of your claims from July through February. Since we have the budget to go over, this is just a brief update, so it won't be the full plan review like we typically do. But again, like you said, Craig, everything's looking to be ending up, it's going to end up to be a pretty good year if everything runs the same way. When we annualize your claims out through the end of the year on a per employee per year basis, we're projecting you to be down 10%. And then when you add your fixed costs in, we're projecting you to be down 9%. On this page, but not throughout the reports, are the specialty HRA claims that are added into the pharmacy piece here. Since they don't flow through the data analytics system, it's not going to be in the following reports. but that was about $92,000 in specialty HRA claims. But again, your medical plan and pharmacy plan, if they run the same way through the first 8 months, we're projecting you to be at a negative. Okay. If we just look time period to time period, your medical claims are down about 4.5%. Your pharmacy is where you're seeing an uptick. You did have an increase in your enrollment this year, which typically that means that you're going to have more members utilizing the plan. So I have a pharmacy piece that we'll go over, but the pharmacy plan is really where you're seeing the increase in cost this year from last year. When we break it down on a per member per month basis, your medical claims are down about 11%. The pharmacy is still up about 5.5%. So when we net it out, you're still at a negative. We're projecting you to be down about 6%. When I look at some of the cost drivers within your plan, again, pharmacy is up. Your inpatient claims are up. Just slightly. You did have an increase in your inpatient claims and your inpatient days. A lot of those coming from the maternity admission and the NICU admissions that your plan saw this past year. Your outpatient claims have dropped. You had a reduction in surgeries, and then you also had a reduction in colonoscopies and mammograms this year. So that factors into that outpatient per member per month, and you're below our benchmark there. And then office visits I'll get into in a couple pages, but your office visit per member per month did drop from last year to this year, and now you're just slightly above our benchmark. As Lisa mentioned, you did have fewer facility claims this year, and you saw a reduction in your large claims. So when we look at your top hospital providers, St. Elizabeth continues to be your most utilized provider and your top paid hospital provider, followed by Good Sam and then Children's. You had about $1.4 million in total facility spend, which was about $378,000 less than what you spent last year, year to date. Total facility spends down here. If I look at last year, same time period, again, St. Elizabeth was the top paid and most utilized provider. Last year, Children's was the second top paid facility. Last year, you had about $1.7 million in facility spend. Okay. Taking a look at your large claimants. So we're looking at anybody that's met half of your specific deductible, which is $85,000. So we're looking at anybody over $42,500 in claims. You had 10 individuals that met that threshold so far this year. 5 of them were dependents, 4 were employees, and 1 was a spouse. Compared to the prior year, same time period, you had 15 individuals that had met that threshold. So you've had fewer large claimants so far this year. And from a dollar standpoint, it's about $281,000 less. Also, the good news is out of the large claimants that you've had so far on your plan, you can see where it's highlighted green. Their prospective risk score, which is looking at the following 12 months of this plan year, is actually going down, which typically means that claims will also follow. So as far as the baby, this was the NICU and patient stay. It looks like the baby is getting better. The claims are going. This current year, that individual is at an 18.5, which means they're costing about 18 times more the average person on your plan. Going into next year, it's dropping to a 4.6. Any questions on your large claimants? Just under $1 million in large claim activity this year. When I look at last year at the same time period, like I mentioned, you had 15 individuals that met that same threshold, and total plan spend last year at the same time was about $1.2, $1.3 million. Okay. The next page are your utilization metrics on a per 1,000 basis so that you can compare yourself to our benchmark. Anywhere you're green, you're performing better than our benchmark. Anywhere that's red, you're higher than our benchmark. The next page are your actual metrics. So a couple things that I wanted to point out, your urgent or your ER visits dropped pretty significantly from last year to this year. So they went down about 16%. You did see a small spike in urgent care visits, but if they switch from the ER to the urgent care is obviously less expensive than an ER visit. From an office visit standpoint, you did see an increase in overall office visits. You also saw an increase in your preventive visits. That's the only metric that when it goes up, you're going to see it turn green. You saw a jump in mental health and routine visits, but a drop in substance abuse. You had 53 mammograms this year, 17 colonoscopies, and a slight decrease in your outpatient surgeries. You had 88 versus 89 last year. 5 babies, 3 of them were C-sections. This is really one of the main differences between last year and this year was the increase in your inpatient days. A lot of those stemming from the maternity inpatient day and the NICU admissions. Any questions before I jump into pharmacy?
No questions, Brooke. Thank you.
Yep. We do have your Well Living Compliance Report. This was updated on March 13th, so just last week. From what we know so far, you're at about a 45% compliance on annual wellness exam, cholesterol 68, colonoscopy 53, mammogram 64, pap smear 43 through 58, depending on age. And then getting into the pharmacy report, as you know, you saw the spike in your pharmacy claims. If we just look at your top 5 medications, you did see a spike in the overall cost of Ozempic. It was your #1 medication last year, and it's also your #1 medication this year. Mounjaro, you didn't have any utilizers on last year at the same time, and you do have some utilizers this year, so that jumped. Jardiance, what you spent with Jardiance increased, Eliquis, and Farxiga. The top class that you're seeing on the pharmacy side are your diabetic therapy medications. We went over that. If I look at the number of people that are utilizing the pharmacy plan, you can see last year you had 468. This year you've had 487. So you do have more utilizers this year. If I look at the number of scripts, they've also increased. So we've processed 5,106 scripts so far this year. Compared to last year, we are about 4,885. The number of scripts per claimant, though, since you did see the increase in utilization, has stayed fairly steady. When I look at the number of scripts that are generic, your generic utilization is at an 87% generic utilization, which is excellent. Anything above 85% is ideal. Only about 13% are brand. And then this is just broken out on a monthly basis, your pharmacy utilization metrics. And here you can see a comparison of your top 20 medications from last year, same time period compared to this year. So again, Ozempic is your #1 medication. It was also #1 last year. Same time period last year, you had spent about $80,000, and this year you're just over 100. Manjaro, you have 11 members on Manjaro. Total plan paid this year was about 37,000, followed by Jardiance, Eliquis, and Farxiga. Any questions? Okay. And then we just get into therapeutic classes. Obviously, diabetic therapy is your top therapeutic class, and it did increase about 20% from last year to this year. And then if I look at your age cohort after 40, which is typical for most groups, you can see the cost per claimant and per script continues to go up. And then if you want to study different therapeutic classes, you can take a look at this report. It breaks out all the medications and what therapeutic class each medication falls under. And that is the MedBin report.
So I guess my only question is ever since we started this 10 years ago, we've always run kind of a little bit above on pharmacy, kind of like no matter what we do. And I think we made some really good steps and changes with our pharmacy plan, creating Plan B, and then also just creating the HRA and getting rid of specialty meds. But these, Ozempic class drugs, we've restricted it to you must have a diabetic diagnosis. But I'm not quite sure how hard that is to get, most people who are in the class where they're going to want to use those GLPs are probably going to have that diagnosis anyway.
I mean, there are perimeters in place to where we're restricting individuals, say, if they just want to try to get the medication for weight loss. Obviously, at this point, we're also, I feel like, competing against some doctors who feel that there's an advantage for people that are on GLP-1s that don't have a diabetic diagnosis. But still, to get this medication on your plan, you have to be diagnosed with diabetes. You have to try other therapies before you can just jump to an Ozempic. So people that are getting Ozempic, and Craig, this is happening across our block of business. I mean, we're just seeing a spike in these, and people are going through the therapies. They are meeting the criteria. The good news is right now, with the competition going on in the marketplace, we're maybe seeing those costs of the Ozempics and the Manjaro start to drop a little bit, but we're continually monitoring it. You guys have done a lot to cut down on the cost of your plan, and for a while you did drop in cost, but now I feel like you're steadily going back up. The average, and Lisa can speak on this too, most groups are seeing a higher trend on pharmacy claims nowadays than they're seeing on medical claims.
That's true. Brooke, since we're changing vendors in July for the specialty drug sourcing, and we're going to be using a different mail order vendor, is there a possibility, can you check to see if under the Rescribe program we could get the GLP-1s from Canadian sources for less money?
Yeah.
No tariff impact? Sorry, that's not funny.
No, we don't think the tariffs are going to affect the drugs coming from Canada at this point.
Okay. I was like,
Good question.
legitimately, I was like, yeah, I go, that'd be I know we've been seeing, there's been a lot of conversation around a couple of things, in commodities. So I was just like, well, I go, if they're coming out, I was like, I don't know if those are impacted. Um, but no, it was like, Craig, good question. Cause I go, that was same thing I had for Brooke with the pharmaceuticals.
Brooke, one other question. Do you know for the large cost for our HRA, is that primarily due to the fact that the recipient doesn't qualify for the discounted rates through the pharmacy company?
Correct.
Is that
Yep.
is that the driver? Do we know if is it like a group of people or just one, or is is that is that kind of across the board requirements, or when we change vendors in July, will any of that change as far as those qualifications for I guess to take advantage of the the discounts?
Those typically don't change because the manufacturer's the one that's setting those requirements. I don't have the list of who's getting the medications through the limited use HRA. Abby or Lisa, do you have?
Yeah, I think there are just a handful, 3 or 4. Does that seem about right, Craig?
That's right.
Yeah. And the only time that happens is when somebody has worked with our Excel centers and they, because of their household income, did not qualify for the manufacturer's program, or the manufacturer just doesn't offer a program.
Right. And also just speaking from experience in regards to one of those handful of cases, because I'm a little bit more familiar with it, that individual also had to try several other less expensive medications and trial those before landing on the one they had, and the other one simply did not work, and so I kind of saw that firsthand, and that process does take months. So the individuals who are receiving these drugs through the HRA, have kind of been put through the ringer somewhat in order to make sure that they need to have those specific medications in order to treat them.
Okay.
Any other questions? All right. Hearing none, I think this is the part we're all here for today. The funding recommendation for next year.
All right. Where'd they go? Somehow they have. Okay, can everybody see the spreadsheet?
Yes.
Yeah.
Okay, great. All right, so this is our health plan projection for fiscal year 2025 and 2026. So the column B is your actual cost through February. Column C is the projected cost for the rest of this plan year. And then column D is the projection for next year. So I'll just kind of walk you through what we have here. And I'm going to just focus on the fiscal year 25 projected cost, the middle column right now. So you've got fixed costs, and those consist of your stop loss premium and the administrative fees that you pay to MedBen and Cheryl Morgan, and then some other administrative fees, some banking fees, board insurances, and so forth. So we are projecting that this year, all of those fixed costs are going to come in at about 1.1 million. Okay, then for next year, we're actually being very conservative, as we always are at this point, and we are projecting a 30% increase on your stop loss premium. That may or may not come to fruition. Generally speaking, we've done better than that, but we always like to err on the side of caution and just assume that it's not going to be a stellar stop loss renewal. And if it comes in lower than that, which it probably will, then great. But at least we're prepared for it. And then a small increase on the administrative fees. And then actually a little bit of a reduction in the smaller administrative fees there. And that is because I think we got caught up on some fees that were owed to the ad for helping to administer some of the financial components of the plan. So next year, we're looking at about $1.3 million in fixed costs, conservatively speaking. Okay, so now let's look at the projected claims. So if the last 4 months of the plan year continue on as the first 8 months have, then here's what we would project for this year. So about $4.1 million in medical claims, stop loss reimbursements of about $520,000, because you've got people who are over the specific, and you've also satisfied that aggregating specific deductible, the one-time liability that you took on in exchange for a reduction in stop loss premium. We'll get into that more at next month's meeting when we do the stop loss renewal. So your net medical claims should come in at around 3.6 million. And then pharmacy claims, including your specialty drug HRA claims, should be about $1 million. So total projected claims costs this year should be about 4.6 million. Now looking at next year, claims should come in at around 3.6 million. And then pharmacy claims, including your specialty drug HRA claims, be about $1 million. So total projected claims costs this year should be about 4.6 million. Okay, for some reason I'm hearing what I just said repeated back to me. I don't know why. Anybody else hearing that?
Yeah, Clay, can you mute?
Okay, so for next year then, we're making an adjustment for high claimants because this year has been an unusually good high claimant year. So what we do with this is we look back 5 years and we look at your high claimant impact to your plan each of those 5 years, and then we do an average. And if you're below the average for the upcoming year, then we're going to add in some additional high claimant liability. What we do with this is look back 5 years and we look at your high claimant impact.
If somebody's watching the video feed going out, can you mute that?
And if you're below the average for the upcoming year, then we're going to add in some additional high claimant liability. Okay, and then the board has already voted to interject some steerage to St. Elizabeth into the plan design for next year in exchange for some improved discounts with St. Elizabeth. So that's worth about $146,000. So we're subtracting that from the equation. And so the total medical claims then we're projecting to be about $3.6 million before we add in trend or inflation. And for our non-reference-based pricing plans, plans 1, 5, and 6, we trend at 7%. For our reference-based pricing plans, which is most everybody, most people are out in plan 9, and we do have some on plan 10. We trend at 4%. And then we trend pharmacy claims at 7%. So we're projecting $1.1 million in pharmacy claims next year. So next year's claims projection is about 4.8 million. And a little bit of an increase on the PCORI fee, pretty negligible. So total plan costs then this year are at about 5.7 million. Next year, we're projecting them to be about 6.1 million. So you can see what that looks like on a per employee basis. 17,000 this year, 18,300 next year. Okay, and then in terms of revenues, this year we're on a pace to collect about 6.1 million in premium. And you will have pharmacy rebates of about 141,000. You did get a refund of some fees that were mistakenly paid to a company called FIA. They did some out-of-network repricing that really didn't need to be done last year, and you got the credit for that this year, about $70,000 there. we're projecting that your interest will be about 35,000. So total revenues of about 6.3 million, which results in a surplus of about 642,000. If you add that to your beginning reserve amount of 1 million, about 1.9 million, we're projecting a year-end reserve of about 2.5 million. Next year, if you carry over the same premiums, so you don't raise your premiums at all, and then we project, some increase in pharmacy rebates, and we just kept the interest the same. So total revenues of about 6.3 million, and that would be a surplus of about 149,000. So add that to our projected year-end reserve for this year, that would put you at about 2.6 million. Okay, any questions on that? Okay, so now I want to jump to reserve recommendations. Everybody see that?
Yes.
Okay, so the way we do reserve recommendations is on a 3-tiered basis. So in order to have what we would consider to be a minimal amount of reserve on hand, that would be enough to essentially pay your run-out claims. So if you would disband the plan, there would be claims that had been incurred but hadn't been paid yet before the self-funded plan ended. So you would be responsible for those incurred claims. So at least a month and a half of claims is what we would consider to be a minimal amount of reserve. So based on your projected claims next year of about 4.8 million, that would be $600,000. Then the second tier is enough money to offset some bad high claimant experience. So for that, we're going to estimate that you have 3 people hit your $85,000 specific deductible, and you're going to pay out your entire aggregating specific deductible, which is, I believe, $150,000. And so if you add all that together, that's another $405,000. And that would put you, if you add that to your minimal reserve recommendation, at about $1 million. And then if you want to have an optimal level of reserve, that would be having enough money on hand to account for just bad utilization of the plan in general, a lot of utilization of services, and maybe a bad renewal from the stop-loss carrier. So another 3 months of claims is what we'd like you to have on hand to account for that. And that would be about $1.2 million. So all told, an optimal level of reserve would be about $2.2 million. And under our budget projection, you're projected to be above that. So now I'm going to jump to the reserve policy. Okay. And several years ago, the board adopted a reserve strategy just to kind of take some of the subjectivity out of this process. And one of the parameters of the reserve policy is that if you're above the optimal level of reserve, that you can decrease your funding or keep it at 0. So we're always loath to reduce premiums.
Keep it at 0.
So keep it at 0 is what we would recommend.
Lisa, I just had one question. So the projection for next year, the carryover you indicated, was that going to be close to $600,000? Is that correct?
Yes. Yes.
So that last line excess is 642, 135. Is that right?
That's right.
Okay.
I mean, at some point, if you start accumulating reserves that are far beyond what you could conceivably need. I mean, you don't want to just stockpile money that could be used by the participating entities elsewhere. So at some point, it would make sense to reduce premiums, but I don't think we're necessarily there yet.
Right.
Looking at prior. Oh, go ahead.
I'm sorry. So, but again, next year, the excess is anticipated to be around, am I reading that right? Is that $600,000?
No, that's this year.
Yeah.
That's this year. Next year would be about 149.
Well, I'm sorry. So for this plan year, come July the 1st, we're anticipating to have an excess of 600,000, right?
Mm-hmm.
So the latest financial report, it's got us like we're in the plus like $63,000. So do we
Correct.
anticipate that something else major to happen between the next like 3 months?
Yeah, you've got people who are at or close to their specific deductibles, and you paid out all that aggregating specific liability.
Okay.
So we should start to see money back from the stop loss carrier.
Okay,
And
so we're
you're-
gonna see that in the form of the refunds that we've kind of seen come in a little bit
Correct.
before since they've
Yes.
reached that. Okay.
Yes, that's right.
And Paul, I'll take you one step further. Let's just say for the sake of argument that it doesn't show up, right? And we're still projecting to be, a couple $100,000 over the optimal reserve limit anyway.
Oh, absolutely. Right. So yeah, I mean, I know we're always conservative. The zero sounds great to me. Again, I wouldn't at this point I wouldn't want to like, cut premiums at this time until we see that 600,000 or whatever it's going to be. It's actually in our reserve and we hold that for a year because, we had a lot of, I guess, good years, but last year just, I mean, we're 300 plus, in the negative. So we definitely want to make sure that we kind of equal, that settle those amounts. But I mean, zero always sounds good. And if we had a good year, that's always good, right?
Everyone's hoping for zero, right? You go back and go, oh, actually, hey, we're going to reduce it. The people would be over the moon. But zero is just as good as a reduction to many people, right? Everything's going up. If you can go, hey, health insurance isn't going up, that's a nice win.
Yeah, I agree.
I'm sure every budget had some type of increase, no matter what it is. So if you can put a zero instead of even a 4 or 5%, I mean, it's going to be good across the board for everyone.
Yeah, I had 6.5 built in for our budget already for FY26 and another 2 or 3% for some other things. So I go, the fact that this is zero for my 82 employees is big.
Yeah, absolutely.
Absolutely, yes.
I go between that and the SERS reduction, that might be able to fund most of pay increases.
Anybody else have any comments regarding the recommendation for funding?
No.
Thank you, Lisa, for the info.
Yeah, good info.
Oh, you're welcome. You're very welcome. I want to share one other document if I could before you take any action. I just want to show you your premium history. I think this reinforces some of what we were just discussing, but this is just through the year we're in currently. So your average increase since 2015, 2016, your first year of self-funding, has been 7.8%. Now, if you throw out that first year renewal where it was 23% increase, it's 6.1%. And the reason that we show it both ways is that when a plan is self-funded for the first time, we always expect a big renewal that first year because you're essentially going from a 10-month claims year to a 12-month claims year because it takes some time for claims to be incurred and processed and paid that first year of self-funding. So that first year is kind of anomalous. And so if you take that out of the equation, you've been about 6.1%. Now, if you do a zero this year, that's going to drive that down even further. And during that same period of time, the estimated increases under community rating, which is what most of the plans in the pool would be looking at because they're under 50 employees, has been about 14%. You've done really well. You've done great. And with very few plan design changes along the way.
Nice. Always easier to report when it's good news, right?
Yeah, we like delivering good news. We don't get to do it very often. But
No, that's a rarity in the health insurance space, especially over the last 5 years.
Oh, yeah.
Right. Well, if that's the recommendations, we'll have a formal budget that we'll approve in June, but for now, I guess I'll entertain a motion to accept that funding recommendation.
I'll make that motion, Craig.
I'll
Right,
second that
Commissioner.
motion.
Second by Chris. Any other discussion or questions? Hearing none, all in favor, please say aye.
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 Any opposed? All right, great. Thank you. Next is interlocal agreement update. Everybody should have been sent a draft of the interlocal. I actually think a couple of jurisdictions have actually already taken some sort of action on the interlocal, which is fine. But we did get back a couple of suggested changes. One is there were some typos as far as date years. And so those were all corrected in order to jive with the actual dates that we're proposing for it. But then Paul, who always has great suggestions, brought forward a question regarding the length of time that we have members stay in the plan when they first join, because it doesn't jive with our extended payment period for the buy-in. So Paul, if you want to kind of, are you willing to kind of explain that a little bit more, or do you want me to try to?
Well, from my understanding, and again, I just want to make sure that I was clear and that, again, it helps protect the plan and from this time forward, is that according to what we currently have, it says that we have a minimum requirement for any new entities that come into the plan to stay for 2 years. But it's my understanding that we extended that to a 5 year, so that initial buy-in could be spread out over those 5 years as opposed to them having to pay that for the 2 years. So I would just want to make sure if that language just needed to be changed, or to say if there, minimum would be 2 years, or whatever that time period that we agree upon. Again, I guess that'd be a question for, say, maybe Lisa, to just, again, I just didn't want to put 2 years on there. And again, not that anyone would do this, but just to make sure we cover our bases, that they come in, the agreement would be 5, but after 2, according to the agreement, that they could leave. And they would have at least another 3 years for that buy-in period, technically left on their contract.
I think there might be some language in the buy-in policy that requires the reserve to be paid even if they exit the plan. So, I mean, well, ideally, you'd like them to stay in for the whole time they're paying the reserve. It might be a detriment to new groups joining if they think they have to stay in 5 years versus 2. So as long as you trust your colleagues to continue to pay the reserve amount if they left the pool and went somewhere else after 2 years, I think it's okay to not have those match up.
My gut reaction was that when the board voted to extend the buy-in period, we didn't amend the interlocal itself. We just created that buy-in policy that said, if you tried to leave before the buy-in policy was due, then that bill became due in full at that time. And that was kind of like a board policy. I agree that nobody really can see the future. And so to lock people in for 5 years would definitely hurt. On the flip side, if somebody did take advantage of us like that, let's just say some other entity joined and was here for 2 years and left. And even if they got us for some good high claimants, whatever money they put in, they can't withdraw. The only time the reserve is distributed back to all the members is if we just totally dissolve the pool. So if one person just leaves, then those dollars just stay, and then we're dropping their claims. They're responsible for the run out, and then they're no longer a part of the plan, so they're not really hurting us, to that extent. I don't know. This is a good question, and I'm open to the discussion if anybody else has other thoughts or opinions on it.
Again, so the latest entities that came on and they had the 5-year agreement. I mean, was there a contract that was signed with them? I guess just explaining that they were gonna pay X amount above the regular premium in order for the buy-in, but that would be spread over the 5 years. And is there language in there of what they would be responsible for, if they would decide to exit prior to that 5 years?
That would be probably a better question for Mr. Williams. Because he
Or is it
talked.
contract?
Yeah, there's not, I don't think there's an
Yes.
actual signed document, Paul.
Yeah.
Okay.
They vote on the interlocal. And they don't have to pay over 5 years. I mean, they could pay in one check up front. They can break it out over a couple years instead of the full 5. That was just an option that we were given
Okay.
to lower the premium costs. And I'm not quite sure how new entities have spread that out. I mean, I think Brandy's on and Southgate joined, so maybe she can talk about how Southgate's done that. Obviously, we have the Crescent Villa Fire Authority's on. There's agencies that have gone through that.
Right, we just did over the 5 years, and we're just committed for the 5 years. I mean, I don't know if we really discussed with Mike if we leave after 2 years. We just know it was the commitment, so we spread it over the 5 years to make it more affordable in the monthly.
And Michelle, you're including that in the billing amount that goes out to the entities, correct?
Right, yes, I include it monthly and I have it marked on the invoice that they've gone until 7 of 2029. And I believe all the new entities spread it out over 5 years. Maybe we should add some language to the interlocal that makes that clear, that if that new entities joining have to continue to pay their reserve amount if they spread it out over 5 years, even if they leave sooner.
Yeah, I think so.
Yeah, just to make them consistent across the board, right? A little more clarification never hurts.
But other than that, there were no additional changes or suggestions that were sent. So I guess I'll work with Lisa and Avery because Lisa's the attorney, to make sure the language gets in the local correctly. We'll send that all back out, and then at that point, jurisdictions can adopt that, and I'll leave it to their legal counsel to decide how they want to adopt that. Now, like my city will do it by ordinance. I think some of the counties will do it by ordinance, but I'm not quite sure that everybody else needs to do it by ordinance. So
is it put in there, Craig, as far as the keeper of the records? Is that going to go to the ed district or?
Oh, thank you. Thank you for that one. So the other issue is that we do have a record custodian, and the interlocal's written to make me that person, or whoever the chair is, that person. Personally, I'm fine with that simply because I'm a certified municipal clerk, and so I can do open record stuff with no problem. But as a structure for the organization, would it make more sense to have the official secretary of the organization be the custodian of records? Yeah, probably. So that's that was a good catch.
Well, you had mentioned on at the last, so again, however it would work, just the mainstream, make it streamline it, if you will, just to make sure it's consistent across the board.
Yeah, I think we do make that the secretary of the organization, and I'm here to help. I kind of think because if we are actually open record requested for what we have, a lot of the information is aggregate data, so it just goes out anyway, and it would just be whoever holds it, and if the ed has those records, great. If not, I'm sure other people do, so we can find it and pull it. So if those are the changes, so I'll have to get with Lisa and Avery to get the language in on a 2-year commitment, but if don't have the buy-in paid out when you leave, it's due. And then we'll make the change for custodian of records for open records purposes. Okay. Just to make it all nice and clean, can I get a motion to accept those changes?
Make that motion.
Harry.
Second.
Paul. Any other discussion? Okay. Hearing none, all in favor, please say aye.
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 Any opposed? All right, great. So we'll get that draft out and then everybody can start to move on it. And if your organization has already moved on that, it would simply be a motion to accept the changes. And we'll go from there. Next item is Jefferson Health Plan, and I do kind of want to spend a little bit of time on this. And Chris, I'm going to ask you to help me on this one. We met with Jefferson, Chris and I and Mayor Adams met with representatives from the Jefferson Health Plan at the end of January, and had what I thought was a very productive and open discussion and meeting. I've got, Mike Williams is here too. He can probably help. Actually, if you don't mind, Mike and Lisa, if you could just kind of set the table on what happened during that meeting and what rolled out of it from your all's perspective, and then I guess Chris and I can add some color to those and get a little bit more perspectives. Because if you recall, let me set this up. Jefferson Health Plan came to us. They're a large health insurance, a government health insurance pool in Ohio. They operate in multiple states. They're coming into the Kentucky market, and they initially asked us to be their first group of people that joined their plan in Kentucky. We've done our due diligence and have our discussions, which is what we do. So it's drug out a little bit. And in the meantime, Newport has joined their plans, and I think they have a couple other cities downstate that are also considering joining as well. So they're actually up and running in Kentucky now, and so then I'll let Mike and Lisa take it.
Well, one of the things that became clear in that meeting was is one of the things that you guys have done as a board has been done a great job of changing the plans to meet the needs and keep the costs down low. And also one of the hallmarks of being self-funded, of course, is that you have control over the plan design and this is how we're going to do this and this is how we're going to do that, as evidenced by these meetings. And that has been one of the concerns was with Jefferson Health Plan, how much control would we, as I say we, I mean you guys, still have as a board? I think there was the general consensus was that we came away from that meeting understanding that there was still more control than we originally thought we would still have, or you guys would still have. Craig, would you agree with that statement?
Yeah, I think so. I think I know I pushed really hard to define them simply as you're providing our stop loss, and they seem to accept that role, and then there just becomes the requirements of, okay, if we're going to be paying them stop loss, then those funds go into their Kentucky pool. And kind of help support that Kentucky pool, and then if we needed a stop loss, they would be there to kind of help us out, because that's what they've signed up for. And it seemed that we did come to an agreement that the board would still be in charge of setting our premiums and stuff. It's just that if for any reason we set it outside the parameters of where they thought for stop loss, well, then they would just limit kind of where we were. And that's actually not a unheard of statement, because our current stop loss people would do the same thing. if we didn't approve a solid budgetary plan, they would throw red flags.
Mhm. Lisa, do you want to chime in?
Yeah, I think a lot of the discussion too focused around how becoming part of that bigger pool would ease the ability of new groups to join, because there would not be the reserve buy-in requirement that we currently have, because Jefferson is big enough and they have sufficient reserves on hand that they can just have new groups join without having to kind of capitalize. And so it might be a good opportunity for us to really, grow the group in a way we haven't been able to. I mean, we've had sustained good growth, but it might really take off if we didn't have that additional reserve buy-in requirement.
Yeah, this gives us a easier pathway to get to that 1,000 group member pool and kind of alleviate some of that, get us out on the other side of that bell curve in the downward trend of exposure and get a bunch of those benefits. Because we're a conservative group by our nature, right? We've had several great years looking, for the next 20. Hey, where's that got to go? We've been fairly, if I'm recalling from the slides, we've been fairly flat with a slight uptick in membership. It's not that we've really grown, but we really haven't, reduced either. So I go, in keeping with that theme of conservatism, I go, we've got to grow to be able to kind of spread our risk about. And I go, and if I'm remembering correctly, Mike, Lisa, and Craig, I go, a lot of our reserves still stays under this original board's control. That doesn't go into the Jefferson pot, become theirs.
Right.
We now have this reserve, and I go, I'm going to butcher it, so I'm not going to, get too in the weeds on this because that's back from January. And it was like lovely setting at Fort Mitchell Country Club, great information. They really brought probably about 6 people more than they needed, but we had every resource we could to have that effective conversation. So I go, but we still have that reserve. The board they still bring information to us. This board still makes a decision. Our stop loss carrier just includes Jefferson Group and then Newport's in it. It kind of spreads that risk around a little more. So I go, once again, I know the ad's not new to this group, but as myself as a representative for the ad's a little newer, so I go, I try not to be as vocal, still in the learning sponge phase. But I go, in seeing that we're always talking about being very conservative financially, perfect example is the decision we just made. It was clear we could probably go back and reduce rates, right? We could go ahead and go roll out to everybody, hey, not only are they going to stay flat, we're actually going to reduce them a couple percentage points. I go, and we go, you know what? Let's just wait another year and see, because, it's always easier to not have to request more money than to spend it and then need it later. So I go, knowing that that's how we think, this seems like a very logical step for us. I will not speak for everyone, but in how we have operated in the 11 months, 10 months I've been around and seeing how consistently our group thinking is on, okay, what makes us safe? What's not risky? We want to avoid risk, right? We're never going to be the truck driver that's driving on the mountain road right on the edge. We're going to be as far away as possible is the group motto. So I go, this Jefferson social stop loss transition seems within that theming.
Yeah, this reminds me a lot about when we first were talking about forming the pool, and we were being shown the savings that we could get because by being self-funded, we keep the money ourselves instead of paying private insurance companies to provide us medical coverage. And I think the premium history has bore that out over the last decade. And I think we're kind of in that same spot where we're buying stop loss from private companies and that have overhead and have other shareholders and things. This was basically taking our stop loss and making it, funded through a government nonprofit. And I think long term, it might actually save us But I actually want to see their quote. We have stop loss coming up. They can quote it just as much as HCC and some of the other companies that we've used in the past. And we just see how they fall. The issue is if they are the lowest stop loss and the people who make the most sense for us, they're going to want us to join their plan. And I've already talked to our city attorney, and she indicated that as a interlocal agency, we can enter into an interlocal agent in agreement with another agency without having to have every single jurisdiction's board approve that. So we have that ability to enter into that agreement as this board. So that's really the big difference to me is simply if we go with HCC, we sign a contract, which is a lot of pages. It's almost like a mini mortgage. But if we join, if Jefferson makes the most sense to be our stop loss, and then we join them, they're going to want us to join their pool, and that'll just simply mean that the premiums go into a bank account that they have instead of the one we have, and we don't lose anything in our bank account. It just funds them, and I think there's still mechanics we can talk about regarding that, because I still like the idea of having our own bank account with our own premiums in it. But we can talk to them about that and see how that rolls, and maybe we all pay ourselves, and the health pool pays one check to Jefferson every year or every month for that. We can work that out, but that's the thought. I really would like to hear some of what you all are thinking on this.
Craig, so unclear. So what would be the role of Jefferson Health Plan? Is it solely as a stop loss provider? Because I mean, again, I'm sure there's a lot of talk and probably looking way down the road. But you're saying that they would also want us to be part of the pool. But
Right.
initially, would they just be able to provide that stop loss insurance as opposed to going to HCC?
Yeah, they bid on that. Actually, they bid on that last year. They actually gave us a stop loss quote last year. They're going to want to also kind of take over some of the tasks that we do internally, from the standpoint of I do a lot of our banking. Most of you don't see that in the backdrop, but I do that. And Chris Corba has stepped up and helped doing some of that. Since we've gone to positive pay fraud prevention with Heritage, Jefferson Health Plan is offering to take that on themselves and kind of do our financial banking for us. There's a cost to that, and I've talked to Lisa about that cost. It's like, I'm not sure I want to pay that cost, but if their stop loss is significantly lower than a current or other vendors, and it's able to absorb that, then I'm not so sure why we shouldn't do that.
So what would be the time commitment that we would have? Is it just an annual contract, or are they wanting a 2-year commitment, or?
Chris, remember me if I'm wrong. My impression was in for a year, out.
Sorry, you cut out, Craig, one more time, my friend.
I'm sorry. My impression was that you can sign up, stay a year, and leave if you wanted to.
Yeah, it was very much there was some flexibility in that. Just because we sign up, for FY26 or FY27 doesn't mean that we've married them and now they're like Cheryl Morgan and we're in this long-term relationship. We can go, you know what? It didn't really work out the way we felt it was going to. You portrayed it this way and our experience was X, and it's just left a bad taste in our mouth. It's been great. We're out. And treat them like a college coach and move on to the next one, right?
Yeah, they do have a notice requirement. I think it's 6 months. So, I mean, that'd be the trickiest part. We'd have to kind of know well in advance we want to get out by the renewal date. But that's pretty much it. You can get out from you could decide after a couple of years it's not working and you want to leave and go a different direction. And you get all of your reserve back.
Yeah, all the money we paid them, all the money that sits in the account they create. If we
Yeah.
don't use it all and
That's
run it, they give it back.
That's right. If you've accumulated reserves there, they give it all back.
I think we let them quote.
Yeah, so again, I'm still, these lines are a little blurred for me, and I apologize if I'm just not quite understanding, because when we
No,
talk about
totally.
if we accumulate a reserve and then we get the money back, but if they're just solely taking on a stop loss, I would see that as paying them a premium, right? And I know they're a nonprofit, so they're trying to accumulate other groups. And we would have been a good one, but I think I've said it before, do we really need them? I think initially here they need us way more than we need them, because if they would establish a relationship with us, then they could say, well, look at this group, they're doing well. And, then I'm sure they can add on, more. I don't know what Newport's situation was, but I mean, I'm with you, Craig. I like, we've got our reserve, and I want control over that. Ultimately, I mean, I think, having control over what our premiums are, that's going to be the driver for all of us, right? We want to provide this uh, service to all of our employees, health insurance. But ultimately, we got in this group because we had no control. Was it going to be 20%, 30%? Whatever. There was always someone else dictating that. And we're very conservative, and the recommendations of Sharon Morgan, which, they do a lot of homework, and those numbers make sense to us. I certainly don't want another, I don't want to chart in front of me next year of where it's just not making sense, because now this cost is going to go up. For us on the premiums, or we don't have as much say as we do, because there's just been a tremendous amount of work to go into this. So, I mean, if they would play a role as being a stop loss provider, and we could get a discounted rate for that, and then also take some of the burden off of you as doing some banking, and we kind of come out even, but they don't have control over our pool of reserve and our premiums. Then I say, that would, I could live with that relationship there, as far as that goes, and then kind of see how it goes. But my question would be, is do they have that type of relationship with any other entity? Do they just provide the that stop loss coverage, or is everyone that they have a contract with, is that, do they have their, are they providing that reserve pool, and then paying the premiums out of that?
Well, I can't speak to all of their situations, and I know they have some sub pools like yours would essentially be. But the normal group in Jefferson House Plan, we have two in their pool now, say Newport and Sycamore Township over in Ohio. Jefferson has set their rates and established what their reserves need to be, and they hold the reserves. They tell the group, this is what your renewal is going to be. So it would work a little differently with you all, because you're coming in with a considerable reserve that you can use to defray, any increases that Jefferson would feel like you need. And you would also still have the ability to make decisions about who joins your sub pool. But you're in a kind of a different place than the normal group coming into Jefferson Health Plan, which, I mean, they're really designed to help smaller public entities who can't, get to a sufficient size to self-fund on their own, have the ability to self-fund.
I mean, do we have information on what the average increase in premiums for the Jefferson group is?
I think they provided that, but I don't remember it off the top of my head. We can get that before the April meeting.
Because I mean, we just looked at ours, and I mean, our average is 6.1. And I mean, again, you look over the
Yeah.
years, and we take out that first year, and so it's 6.1. So I mean, it would obviously have to come under that if that's their average. But
Yeah, I think it's about 6%. But don't hold me to that. I'll get
sure.
that for you. But I think it's pretty comparable.
But to your point, also the new groups that come in, if they don't have any reserve or very little reserve, Jefferson comes in and says, "Hey, don't worry about it. We've got your reserve, and we're going to provide your stop loss." And 6% or even 8% to them if they're coming from the community rating. I mean, they would welcome that, I'm sure. Which,
Yeah.
if this came along 10 years ago, we'd be in the same boat, right? Because that we wouldn't have the reserve we're at right now, and we would all be coming from community rating, and an 8% or 6% as opposed to a 20% from Humana or whomever. That would be, bring it on. So
Um, if you go back out to the SharePoint, there's a proposed meeting schedule, and I quickly edited that right before the meeting got started. And I added an extra column, and I'm proposing that next month's meeting, the April 25 meeting, actually be in person at the ad district for all of us. And then we also have Jefferson there, so they can talk about this and ask, and you all can just point blank, fire them up like I know you all can, and kind of go through that process. But before I had them in front of us, I wanted us to have this discussion amongst ourselves without them here, so we can even see if we even wanted to have them in to do that. Because I think the long-term issue for us is not that we're bad right now, because I think we're doing great right now. But the reality is that the number of members, the number of belly buttons that we have in our plan has dropped over the last 10 years, and we're older than we were 10 years ago. And if that trend continues, we could be in a position where we might have to start asking for higher premium and everything. Or we might exhaust them. I don't think we'll ever exhaust our reserves, because I think we're conservative enough to maintain those. But I think we're going to have to take some really big premium swipes as a result of it. And Jefferson's offering a way to help us spread that risk out over a larger group of people than just ourselves. And I think that's also part of the discussion.
I agree.
Yeah, you'd be spreading risk over, hundreds of thousands of lives, not just hundreds. And then for the long-term prospects for your plan administration, I mean, you probably don't realize how much work Craig does behind the scenes. I mean, he really puts a lot of time into the administration of the financial components of the plan, and with Chris's assistance. And 10 years from now, I don't know if Craig's still going to be working. I don't know what Cheryl Morgan's situation will be. So I think it's a way of providing some stability for the plan for years and years, because it simplifies some of those administrative functions.
That's good clarification, Lisa.
So is anybody opposed to having an in-person meeting next month and having Jefferson there? Okay, I'm not hearing anything, so.
no, I mean, if they can come and provide, kind of clear some things up. I mean, they might have to write it in crayon to make it clear for me. But yeah, I mean, if they can come and kind of say their role, and again, I'm always want to do obviously what's best for the group and whatever provides the best service for our employees, and it's getting tougher and tougher, right? Because there's always something. To your point about the medical, like it seems like we make a big change and then there's another something else that's going to come along and take some more money from us.
Yeah, but for
So
how many years have
we're doing really well, but it's like all the hurdles that continually get pushed up in front of us. It's like, well, what else can we do?
Yep.
So if this is something else we can do to improve for everyone, I'm for it. I just have quite a few questions and certainly don't want to get into something where a year from now, like I said, we're kind of regretting that because we just don't have the control over our premium numbers. And that's probably the biggest thing. Like with our budgets, and because again, that's a trickle down effect. We spend more on health insurance, it's going to be less on raises or equipment or whatever it may be, and it's for everybody. So
that money's got to come from somewhere, right? I go, just just to your point, for how many years have our employees got raises and go, hey, your raise goes with the health insurance. The 6% health insurance isn't a true, taking all your 6% and your wage increase to your 5%, but it's like, oh, yay, more health insurance. So,
Sure.
it's one of those things. If we continue to be conservative and be proactive, like we've been under Craig's leadership and with the good partnership we have with Cheryl Morgan, we're talking about things that, to be very candid with you, Paul, we don't even really need to be worried about yet. But in this space, if we're not doing something until we have to, it's too late. So we're spending a little extra time going, just in case we happen to end up in this position, we're going to be better suited. Because by the time we kind of see it on the horizon, it's almost too late to, steer the steamship to safety. So I go, and once again, I go, no need to apologize for needing more explanation. Craig and I and our good mayor went ahead and just went to a pre-talk and go, maybe it doesn't even tick any boxes and there's no point to waste any of the group's time. Go, oh, all right, this was beneficial. There are a few more things. Hey, we're going to kind of bring what our bullet points. We were there for 5 or 6 hours and we're rehashing it in 24 minutes. So I go, obviously we're not going to paint a perfect picture, but I definitely think they gave us enough good information. It's like, oh yeah, we'd love to come to have you talk to all the members and hear all the information we heard.
Sure. Well, I mean, I will say it can be to whomever if they come out to the meeting. I mean, if they can come with some numbers as to what is their average increase in premiums, if you're part of the pool, I don't know if they'll have the numbers yet. I'm sure it'll go out with the rest of our stop loss. But I mean, how much would it cost for us just for stop loss coverage? But then also what that other service to relieve some of the burden on that Craig, shoulders as far as taking care of the banking and uh, you know those other tasks. How much would that cost? I don't know if it can be piecemealed like that or if they're looking for a full commitment or what. I mean, again, that's what we could get from that meeting.
Right. And I want to be clear, this is not gloom and doom. We don't have to make a decision. I mean, we can just listen to them and decide to keep on going
Sure.
on. I mean, but they've been persistent and there is an opportunity. And so I think we at least owe it to ourselves to at least sit down and explore it.
That's
Sure.
a good clarification, Craig. Yeah, we don't have to make any decision. We can choose to just stay what we're doing. It's just, hey, we love to take a couple year look into the future and, kind of try to err on conservatism. So I go, this lines up well with our group's way of thinking. But no, good clarification, Craig.
All right. Anybody else? Okay. That's all I have as far as agenda items. Next would be announcements and reminders. So with the request to meet with Jefferson, I guess I'd like to have a motion to have the April 25th meeting be in person so that we can go ahead and get that. And hopefully the ad has a room. They should have a room.
On the
Yeah,
last
cool.
Friday of the month, your chances are pretty high.
No, okay, so, all right,
We we have already booked the room for you guys. Just did it.
okay, cool. Awesome. So, is there anybody opposed to that change? To meet in person at the ad on April 25th at 9 a.m.? Okay, I'm not hearing anything, so we'll go ahead and book that. Any other announcements or reminders? Cheryl Morgan, Health and Innovation.
We have our conference coming up. There will be more details coming out, but just keep that in mind. That's in September.
Reds game and Cincinnati, I believe.
There'll be we'll have a Reds game as a social event. There'll also be a performance by an up and coming country music singer who happens to be Mark's nephew. But he's actually playing a lot down in Nashville and all over the place. And then the conference also coincides with the kicking off of Oktoberfest. So it'll be a festive conference.
Couldn't have planned it for a better weekend, right?
Yeah. Yeah, the only thing that kind of threw a wrench in it is that Billy Joel and Rod Stewart announced their concert dates, and that kind of screwed up the hotel arrangements a little bit. But we got it figured out.
Anybody else have anything for the good of the order? Okay. Not hearing anything. I'll entertain a motion to adjourn.
Second.
All in favor, please say aye.
Aye.
Aye. All right. See you all next month.
Thank you.
Thanks, everybody.
Bye-bye, everybody.